I am Dr. Joseph Mayo, Chief of Cardiology here at Marietta Memorial Hospital. I have a fascinating story to tell you that relates to women and heart disease. When I was very young, I remember my mother telling me, "Son, you have to be really suspicious and careful about women because they can be very tricky." Well, little did I know that she was exactly right when it comes to women and heart disease or their gender. We have a story to relate to you. It has to do with my office manager, Cheryl West. You'll learn by personal experience some of the symptoms she was having that could have been easily overlooked, but ultimately led to additional diagnostic studies and the realization that she did, in fact, have heart disease. Cheryl, tell them your story.
Hi. Yes, we had been coming back from lunch one day, and everyone was taking the stairs, so of course I also took the stairs. However, after the second flight of stairs, I was becoming very short of breath. I didn't think I was really going to even get out the door to get onto the elevator. I was so very short of breath. So I excused myself, did get onto the elevator, and Dr. Mayo and our nurse practitioner followed me to the office and talked to me a little bit and suggested that I get, not suggested, but insisted that I get some testing done. I had some blood work done, and then I also had to have a stress test done. My stress test revealed not very much, very subtle changes, nothing very overt. However, Dr. Mayo decided and insisted again that it didn't matter, I needed to have a heart cath, and thank goodness I did have the heart cath.
How did you feel about your shortness of breath personally? What did you think that represented?
I just felt like I had kept saying, I'm just overweight, I'm getting older, I'm just a slug. I don't work out anymore, I don't exercise, and I just kept putting it off. I thought maybe, well, am I having a chest pain sometimes? And then I kept thinking, no, I couldn't possibly be. Not me.
So a typical story of subtle symptoms, but yet representing something very serious. Well, when her ECG was not normal, that led to the heart catheterization. She, in fact, had a 90% blockage in the LAD artery, the area of the circulation known as the widowmaker, and ultimately she had a stent placed and now has been doing great ever since. So the take-home story is women, in fact, are different when it comes to heart disease. Symptoms can be way more subtle than men, and you have to have a healthy degree of concern and dig a little deeper when things don't come out exactly the way you think they should. In this case, there's a happy ending to the story, but that isn't always true. So women, be your own advocates. And when you know you're not feeling well, then make sure somebody's paying attention to that and looking very carefully at your medical history. Women and their cardiovascular symptoms are usually different than men. A good example is the textbook case of a male patient having heaviness in the chest, feeling as though someone parked a big weight on their chest. The female will rarely tell you that. More often they'll say, I feel short of breath with exertion. And their rationale is, they put on a few pounds, they're a little older, and probably doesn't represent anything, but it really irritates them. There's another good example of jaw and neck pain. We have had female patients go to the dentist for checkups because every time they did a certain thing around the home, they would find that their jaw hurt. So they thought they had a dental issue. They went to the dentist. Dentist told them everything was fine. The jaw pain turned out to be angina, which was later diagnosed and treated with a stent. And then finally, one of the classic symptoms is scapular pain. Your or bones in the back here, the shoulder blade area, is referred to as the scapula. And the women will have achiness in the scapular area associated with activity. And that is highly unusual for men, but not uncommon at all for women. So what I like to tell my female patients is, if you know you're not feeling well, you don't need to be your own doctor and make your own diagnosis. Just make it clear to your doctor that something is different and wrong. And hopefully testing will then lead everybody down the right path to the right diagnosis. Now, you know, if you look at the statistics over the last 10 years, more women are starting to smoke again, even though they had a hiatus there for a while. Women also tend to be caregivers to their family and not caregivers to themselves. And so maybe the family is off in the gym or whatever, but mom is home cooking and cleaning and doing things like that to support the family. So I think women in general have to say, you know what, I need time for me, time to make me healthy emotionally, and also try and stay in shape physically. I've seen women in the office in their 50s who have never had a cholesterol level drawn. I find that amazing, mind-boggling. You know, just because you're a female doesn't mean you're immune from heart disease. And normal, regular checkups that any man would receive, of course, would help prevent that. Don't forget, heart disease is the #1 killer of women, more than cancer. And you can't ignore that fact. It's a powerful fact.